Hey guys, Dr. Michael Derry here. I'm super excited to do this today. This is one of my favorite talks recently I gave. It was awesome. It was really engaging. I had a lot of fun and people got a lot from it. Had a lot of good feedback, and I even recorded it, but then for some reason the recording didn't stick. I don't know what happened, but hey, things happen. So I want to go over today how to improve strength and resiliency as we age. And this has been something that I've focused on recently with clients and been doing a little bit of research on. And when I treat people, I've really noticed that something's missing. Something is missing to really get these people to the next level and where they want to be and how they want to feel. And I find it to be my responsibility to make sure that they get there. So what do we need to do to get you there? So again, my name is Dr. Michael Derry. I am a board-certified orthopedic clinical specialist here in Jacksonville, Florida, and I'm a mobile physical therapist. And so I go to people's homes and I take care of them there. And it's a really, really fun setting, very intimate, very much appropriate, and a very, very different experience from actually going to the clinic. And so I've been in business now for 18 months or so, and I love it. And I'm just going to keep trucking forward. So today's objectives. One, I think it's really important to have a better, or maybe not better, a different understanding of aging, what that really is and looks like, how to build that resiliency as we age and what that resiliency is. And so how do you define resiliency? When I say resiliency, what comes to your mind? And when I treat patients, and I've got my definition of resiliency. And so let's bring those things together so we can get that outcome that we're looking for. And so I'm very, very much excited to start going over that. Thank you guys for being patient with me here too. So here we go. And so here's the why. And so I think it's really understand to kind of know where I'm coming from and why I put this together. So from a 15,000 foot view, healthcare system that we have today has really, really bad tunnel vision. And so I don't know how many times I've heard people go into their doctor and they only have time to address one body part. And they're saying, hey, like I've got these issues going on. Okay, so what's your most important issue? Let's address that today. And you'll have to make another appointment for another issue. Really, really bad tunnel vision. And I think people are starting to appreciate it when a physician or another provider really looks at the entire human being and stops defining people as body parts. And so, yes, you do have a back. Yeah, we know that, right? Yes, you do have a knee. Yes, you have this, but that doesn't define who you are. You are not knee pain or back pain. You are Mrs. Jones who wants to get better at doing X, Y, Z and feel better while doing it. And so those different treatment or those different goals and those different definitions require different treatments. And unfortunately, our healthcare system doesn't necessarily recognize those treatments as strongly as they should. And what the evidence is showing too isn't matching with that. So long story short, tunnel vision. We need to really, really reframe the way that we think about things. And I focus on back pain, and I love treating back pain. It's so much fun to treat and see people get better, but we really need to start defining it a little bit differently and looking at it a little bit differently, because unfortunately we've had many, many years of technological advances and understandings of back pain, but we're still not super good at treating it, right? We all know people who are still in discomfort or maybe not living the life that they want to live because of their back pain. So think about that for a second, right? So we have all of these advances, but we're not that much better at treating it. And that's unfortunate. I also think it's really important to start implementing more evidence-based practice that matches the client or the patient's preferences as well. And so where the relationship comes into play. Like, what's the most important to you? What's the evidence say that we need to do first, or at least start, and loosely let that guide our decisions, and so we can make the best decision for you. And unfortunately, the insurance model drives a lot of our treatments. And so a great example of this is MRIs for lower back pain. The American Radiology Council or board, and then the physical therapy and the primary care physician guidelines all say that you need to have XYZ checked before you have an MRI. And unfortunately, guideline care is not being listened to or implemented in practice as much as we would like. And so we've seen that before. We're seeing that a lot. And that's unfortunately leading to poorer outcomes and more money spent. And so we need to stop letting insurance dictate, the treatment be based on reimbursement. We need to get away from that model a little bit. But, I think it's important just to keep encouraging and empowering people to make decisions that are evidence-based and that are at the center. Those decisions are at you are at the center of all of those decisions. And so every decision that's made about your health has you in mind at the center of it, right? And so we shouldn't have to worry about anything else other than that, but unfortunately we do. So I love making sure people have the knowledge and the team behind them to help empower them and encourage them to make the best decision for their health at that moment. And so that's where this talk came to be, because I started recognizing that people needed a little bit more to achieve their goal. And unfortunately, no one is doing that little bit more. So I want to go over that today. But to start, I think it's one of the better things to do is to start thinking about aging. So what comes to mind when you think about aging? Right? Is it your parents that come to mind, or your grandparents, or is it you, or where are you at in life? What really comes to mind when you think about aging? I asked that during my presentation recently, and someone said it's not for the weak, and they skipped a couple bullets on this presentation, but that's 100% true. Aging is not for the weak, and we'll get to that in a second. But when we look at the definition of aging, there's a lot of definitions out there, but when I look at the World Health Organization, I love their definition, and they define it as the ability to maintain and develop function over time. And so you do unfortunately lose a little bit of function over time, because every system in our body is degrading over time. And by system, I mean everything from organs to your muscles to your skin, right? You have wrinkles, you start to feel a little bit stiffer and slower. And so those are all different systems, and you start to lose a little bit of function. But what I loved about that definition is that they say ability to maintain and develop. And so what can you do to maintain that function? And you can develop a better function. Right? And so I'm going over this stuff kind of quickly. And so if anything comes to mind, guys, like leave a comment in the comment section. I love the engagement. This is a little bit longer of a presentation, but I do really think it's important to help redefine aging, and then how to build and develop that resiliency that you're looking for. And so after years of treating patients who are a little bit older, who are older adults, it's made me realize that we're all aging adults, right? And so we can't be ageist. And so if we're being ageist against our future selves. We know that we're going to be older someday. And so we don't want to have those thoughts, feelings, and behaviors that we have now towards older adults. I'm not saying everybody does, but we see it sometimes, where people are sometimes defined by their age, or told they can't do things because of their age, or that they should avoid something because they're more at risk of injury, or XYZ. I don't really like that, right? I think everybody's situation is a little bit different, and we need to treat those people differently based on who they are and what they're feeling. I know some really, really spry 75-year-olds, and I also know some people in their 60s not doing very well at all. And so everybody's situation is different, and you can't define somebody by their age. And like that one participant mentioned, it's not for the weak, right? Aging is very difficult, and I'm treating somebody right now. She's a lovely, lovely, lovely lady, and she meets with ladies that are older than her, almost by a decade, and they just keep telling her, it's just going to get harder and worse, but it's well worth it, right? That fight is well worth it. And then when we think about aging too, right? There's no magic bullet to turn back time. Unfortunately, our society that we live in likes to think that we can turn back the clock on a lot of things, but unfortunately we can't, right? At some point you just need to embrace it and know that, aging is a normal part of life, and we need to do everything we can to maintain and develop function and feel our best. But we have to understand there is no magic bullet, no magic pill, no magic anything that's going to make you suddenly wake up one day stronger, more resilience, better balance, more strength, more flexibility. Nothing like that's going to happen. And so you have to earn it, right? And I know some clients that I mentioned this to, they don't really like it. And sometimes, when I bring it up, people kind of raise their eyebrow a little bit, but I'm a firm believer that health is earned. I've just seen it way too many times. And the people who are doing really, really well have earned it. They have definitely earned it. Now, things happen in life, right? Life throws you curveballs and et cetera, but you building that resiliency is a part of that. And that's kind of the definition of resiliency, is kind of how you bounce back from that. So, and just understand that aging is, just part of life, and there's no magic bullet. I think the last point here is what we can't be okay with. I think that's huge. And so, what we can't be okay with is accepting that we can't do anything about the way that we feel or what the future holds. It is our responsibility, you and I, to do the best we can to prevent frailty and build resiliency, so you don't become that person that you don't want to be, right? Everybody has that future of their future self. And they're like, man, I really don't want to be in that place. So what are you doing right now to make sure that you're resilient and you're living the best life you can with the most amount of function and the most amount of enjoyment as possible? And so when I talk with people about aging, I'm responsible for their physical health. So what do you feel is going to limit you physically in the future, and what needs to be done now to make sure that you have the future that you want? And so just let those statements kind of resonate with you for a second. And when you think to yourself, what kind of future do I want physically? How active do I want to be with my grandkids, or how active with travel, or how active with XYZ? And how do I want to feel when I do it? And I know that, I may not feel the best, but what's my package? Like, what's my team? Who's my team that's going to help make sure that I have that future that I want? So that's something to look at and consider. And it's never too late to make change, right? So change can happen all the time. And that definition by the World Health Organization is maintain and develop function. Change can happen no matter what. So here's the truth, guys. So over time, things do change, right? And I spoke to that earlier. If you look at this graph, you can see on one axis you have age, on the other axis you have functional capacity. And then over time, when we're born and throughout life, that function increases, but over time it gradually decreases. And so there's a couple things to consider with this. Is one, at some point in time, your functional capacity decreases to a level to which you can't do the things that you want to do, right? And so over time, you may have noticed that getting up from a chair is harder, doing XYZ is harder, because that's very normal. What is not normal is maybe how quickly that's happened or not doing anything about it. And so over time, I love what I put in here is just stuff happens, right? So in that gap that you see there, over time, that decline, either from losing your function or being able to level out that decline over time, is just stuff. And some of that stuff may be cardiovascular disease, fall and break something, maybe you develop cancer, or maybe XYZ happens. It's just stuff. Everybody has different stuff, and I can't define what that stuff is. But think about that steady decline over time. It is my goal to level out that decline. And it should be your goal as well, right? There's going to be a point in time where things just really get super tough, but we want to make sure that happens late in life, because that steady decline, and once it happens in that disability threshold, things are going to start to decline very quickly. And so, the saying of live long, die fast, and that's kind of what I want to shoot for myself. And selfishly, I want that for my patients as well, is, how do we live long and die fast? And so that functional reserve is the ability to do what you want to do and have that reserve so you can do what you want to do. And so if you do something out of the normal in your day, you can do it and make sure that, you can get up from that chair, you can get up from the toilet, you can get on and off the floor. Having that functional reserve is very, very important, because when we lose that, that's when we develop frailty. And so successful aging is really just to reduce that decline over time. And so that's really successful physical aging. And so the gamble being here is, if you're going to rely on genetics, luck, time, medication to all level out that curve, if you're going to rely on those stuff, you're going to be really, really disappointed. And so I've seen it many, many times. If you have things in your life such as cardiovascular disease, diabetes, all of these modifiable risk factors and modifiable diseases that you can change that have an impact on your function, if you just rely on medications and other things to help you through that and help you age successfully, knowing that, if this does get hard, I'll just take a pill for this, you're going to be disappointed. Unfortunately, it's just the way it is. And health is earned, absolutely earned. And so don't get risky with your future, right? We want to stack as many cards in your favor. And even though you have XYZ happen in your life, there is ability to make change and fight that, so you can maintain as functional as you can for as long as you can. And I say functional, but that's different for everybody. Playing pickleball, or doing things around their house, or playing with their grandkids, or going on hikes. I don't know. Everybody's situation is a little bit different. Everybody's goals are different. But I think it's important to understand that everybody has goals and has things that they want to do, and that's what you define it. So what drives you? What makes you want to do the things that you want to do? Because you find enjoyment out of them, and you want to maintain that enjoyment. And that's why I'm here. And stuff does happen, but how do we fight that? without relying as much on risky interventions such as medication or surgery, right? All of that stuff comes with risks, and it comes with other impacts on your body. And I hear all the time that people want to get away from medication and not use it. But some of those people are still taking their cocktails in the morning to make sure that they have the management of the diabetes and the cardiovascular disease and stuff like that. And unfortunately, there's some better options out there. So here's the truth. So think about it for a second. What medication do you know? And there's a spelling error there. That's my bad. What medication do you know to impact all of that stuff? So think about you for a second and look at it. So your medication: cardiovascular disease, hypertension, diabetes, sleep, energy, cognition, osteoporosis, sarcopenia, osteopenia, function, pain, falls, a risk factor for falls. There's a medication out there that's been proven to help out with all of that stuff and add more functional, enjoyable days to your life. And give you a second just to guess what that medication is. Just think in your head. Now, if I were you, I would be thinking, okay, so this is a doctor of physical therapy talking. He's giving this presentation on how to add more functional, better days to my life, talking about resiliency and building resiliency. I wonder what this medication is. I love it. The suspense is killing me. So the medication I'm talking about is exercise. And so exercise is absolutely a medication. And when I think of medication, there has to be a certain amount of dosage. There has to be, an intent behind it, what it's working to improve. And so when I think of ibuprofen, for example, 800 milligrams, every 4 to 6 hours to help reduce pain, right? If you don't take enough, you may not have the pain reduction that you're looking for. And if you take too much, you have the risk of overdosing. And the adverse event associated with that is damage to your organs. And so when I think about exercise, well, what's the dosage? Well, some people think that dosage is just 10 minutes a day of gentle exercises in your chair. And while for some that may be appropriate, others that is definitely not appropriate. And so for the person who just had let's say a stroke and they can barely get out of bed, that would definitely be appropriate. For the person that can walk around and go to Publix or wherever and do their grocery shopping and want to improve their strength and only doing chair exercises to do it, that dosage may not be enough to make change. And so we have the intent with the exercises of making change, such as improved strength, improved energy, improved balance, improved flexibility. You have to do enough to make that, to reach that therapeutic threshold. And so if you're not doing enough, underdosing exercise, you're not going to have the outcome that you're looking for. The overdose of exercise would be soreness, extreme soreness, maybe even a muscle tear, right? An extreme overdose of exercise can lead to damage as well. So you can't underdose or overdose. But let's talk about the adverse events. So if it can impact so many systems in your body, what is an adverse event of exercise? Well, one would be injury, but really there's not a lot of adverse events. So you have a medication here that has all of this reward, but with very, very little risk. And so there probably can't be a better medication out there. And I love it. And then what's great is no matter your age or no matter what's going on, or even if you don't have all of that stuff, exercise can still be beneficial. And that is really, really, really cool. But just like every other medication, the dosage is very, very much individualized. And so if you're doing really well in life and want to take yourself to the next level, then your dosage is very different than someone that's just starting out and maybe having a difficult time or maybe haven't exercised in their life. So it's the dosage. And when I see people, when I talk to people and why they got away from exercise, it's because of one of those things. And so maybe they didn't know enough, maybe they did too much, it got really sore, or maybe they thought it hurt them, so they never did it again. XYZ reasons. And so that kind of brings us back to why it needs to be an individualized approach. So think about what's holding you back, right? So we know that exercise is beneficial, and we know that it's beneficial for many, many disease processes, and we can add more functional lives to our days to our lives. And that's been proven scientifically as well. People who are more active and introduce strengthening in our lives and exercise live longer, and they have more functional days of their life. And that's awesome, right? And so think about in your head, like, what's holding you back from doing more exercise? We know that exercise is important. And yes, I'm biased, but I'm biased towards the evidence of what I've seen work. And so this can absolutely work, but you've got to dial it in. That dosage has got to be on point. So what's holding you back? Do you feel like some things are just out of your control? Like your future that you want is really just not in your hands, and you're kind of okay with that. Maybe it's an old body part that's bothering you. Maybe you had this high school injury or a car accident that left you with a bad hip, right? And you're like, okay, like this is going to hang around for a long time, and I'm either going to let this tackle me and take me down, or I'm going to take advantage of what I can do to help improve myself. Or maybe it's genetics, right? You're just like, yeah, my life is what it is, and I'm more susceptible to this because my mom had this, or my dad had this, or my grandfather. And really what it boils down is who you believe has control of your future, of how you're going to feel. All right. Who has the control here? Is it you? Is it your physician? Is it someone else because you would love to do this, but you don't have the time and resources to do it? I don't know. You have to think about who's in control here, but I can tell you right now that everything that I'm showing you and the benefits of exercise can be done in your home with little education and just a little bit of time and effort. And so don't let yourself become frail or vulnerable. Take advantage of the time that you have now to better yourself, and it is never, never, ever too late. So what is resiliency? So when you think about resiliency, adding more functional days to our life, well, things happen during life. And when things happen, how quickly do you bounce back? How quickly can you get up off the floor? If something does happen, do you bounce back in a day and you're feeling good, or in a moment you're hop back up and feel better? Or have you reached a point where you feel kind of vulnerable, right? You know that if something happens, you feel a little bit vulnerable. And I saw this a lot in COVID, and we started seeing evidence come out that people who were obese and had all these risk factors were a little bit more vulnerable. And I've seen the look in people's eyes when they understand, or they finally realize that they are vulnerable and they're more frail than they think. And it's not good. And I haven't been there yet, but I've seen it happen to loved ones, and I've seen it happen to patients. And so let's talk about your ability to overcome frailty and vulnerability, and using exercise to build your physical resiliency. And so we've got to stop whatever's happening and know that the way that you're feeling can absolutely improve. Now remember, I'm biased, right? I'm a physical therapist talking about exercise. So let's talk about some of the evidence. So what do you guys think on this chart here, like the numbers that you see there? Just think for a second. When I was presenting this in front of a live group, they had some really, really good guesses. So when I'm looking at building someone's resiliency, so let's say I'm treating them for hip pain and they're feeling a little bit better. And I know the evidence shows that they need to reach some of these markers here. And so we're going to go over those markers. And so the very first one there, you're going to see, first I want to point out that there are a lot of similarities. So if you look at the American Family Physician Guidelines, the American Heart Association, the CDC, the American College of Sports Medicine, the World Health Organization, and etc. What are the recommendations now for older adults to build their resiliency to add more functional, more enjoyable days to their life? Well, this is it, right? And so we're talking 150 or 75 minutes of intensity exercise a week. And so 150 minutes of moderate exercise or 75 minutes of high intensity exercise a week. Doesn't matter your age. Let that sink in. I don't care how old you are. Now, it is relative to how old you are, right? Your max heart rate in developing these intensity minutes is dependent on your age a little bit, but it's all relative. And so, yes, a younger person has to work a little harder, but that makes sense, right? 2 days a week of strength and balance training, at least, and your total training session to achieve those 150, 75 minutes. When you do that, it should be 30 to 45 minutes because you have a little bit of warm up there. You have the exercise completion. You have a little bit of a cool down. And when they looked at the population data, only 23% of people in these age groups were meeting this. And a lot more were living a sedentary lifestyle. And unfortunately, we live a sedentary lifestyle. I'm sitting here to do this presentation now, right? And people work on their computers more and they work from home more than ever. And we have a sedentary lifestyle, which makes doing this stuff even more important. We have to do it. There's no want to do it. There is a need to do it here, right? So 150 minutes a week 75 or 150 moderate minutes or high intensity minutes. And you have your choice there, right? It's everybody's choice. You've got to do some balance and strength training. So in the overall physical resiliency, it kind of makes sense, right? We want to improve our balance, our strength, and our heart when we break it down. And all of those things improve our entire system and impact all of that stuff that I was talking about earlier, such as cardiovascular disease, diabetes, cognition, your energy levels, sleep, everything, right? And so got to think, okay, so now we know it's really beneficial. 2, it needs to be done. We have all of these groups and organizations and plenty of research to say that absolutely this needs to be done. How do you learn this stuff? Well, this is where I got a little bit frustrated in the medical system, is that you have people responsible for your health that you see. And, this is unfortunately a topic that's not talked about a lot or not influenced a lot, because not a lot of people make money off of this. So you going home and doing these exercises and bettering your health really actually saves healthcare dollars. So you're spending less, which means the people who get the money that you spend at the hospital or wherever aren't making as much. And so it's a little bit of a messed up system there, of course. And there are different influences, and that's not the point of this talk. But what the point of this talk is that if you're looking for something that's very low risk and very high reward, and you could do it every day, and it'll actually add better days to your life, it's exercise. It's absolutely exercise. And so you've got to do it. And when I work with patients, and this is where things get a lot more fun, is because they start to understand that I have their best interest in mind and their future in mind. And when we start doing our sessions to kind of match these parameters of what the minimum needs to be done, they start feeling so much better. Yes, their hip pain is better. And if you're having hip pain that's holding you back, or back pain or whatever, we clean that up first. We get that feeling a lot better. Then we start inching our way towards this, no matter your age or what's going on. And that's really, really, really when you start to feel better. But that doesn't happen right away, right? It takes a little bit of time for that to happen. And we're talking a few weeks of work and you can start to feel better. And so that leads me into what is required to actually make a change. And so when we look at it, what is required to actually move the needle? And so when I started treating people more like human beings than body parts, I started understanding, okay, a little bit more needs to be done here. And so there is no more 2 sets of 10. Like, that just doesn't exist. It's very unique to every person. And we have to understand, like we talked about before, exercise is medication and requires a certain dosage. So you've got to do enough to make a difference and move the needle. Not too much, because you're going to feel awful and you're just not going to do it again. But not too little, because you're going to feel like you're doing awesome and you're doing all the exercises that you should be doing, but you're still not actually reducing your risk and you're not improving your health to the level at which you could be improving it. And so when we talked about earlier, to hit those intensity minutes, you've got to do the balance, aerobic work, and strengthening. And this is traditionally the outline. When I looked at this data, this was like the most common stuff that I saw. So 3 times a week of resistance training of 8 to 12 exercises, aerobic work, that's 3 times a week, and about 20-minute bouts, and then balance work, a couple times a week, about 8 exercises or so. And all of this stuff can be done in your home, absolutely be done in your home. And you can expect that over time that you're reducing your risk for injury, for falls, for cardiovascular disease, for diabetes. You have better sleep, improving your bone density, improved dementia symptoms, improved cognition, less actual hip fractures, just bettering yourself in so many ways and shapes or form. But it can seem like a little bit of a list to get done. But when you dial it in and you learn with a professional, let's say a physical therapist or a chiropractor or a personal trainer, to get this stuff done that's safely and unique to you, you start including it in your day, and then it becomes a habit. And once it becomes a habit, you're golden, right? If you have the habit of bettering your health and using exercise to get you there, you're golden. And I love seeing that in clients when it clicks and they're like, man, I am feeling better. Because after a few weeks, and you can expect improvement in weeks, you start to feel better. And that's the downside of exercise, right? Medication, you can feel the improvement in minutes, where, it does take you a little bit of a while to feel that long lasting relief. And feeling better it could take weeks. And I'm upfront with that. I mean, I feel like people know that and they've been there before. So here's what I'm requesting of you, right? So I need you guys to lead the way, right? If you guys are listening to this and actually taking this to heart, You're either going to do one or two things. You're going to start doing some more exercise and start bettering your health and start making that a habit, because you're reducing your risk factors for all of those things, and you will add more days to this earth. So you're going to think of all the people that are going to benefit from you being on this earth longer, as well as you just wanting to be here. So you're going to be, okay, I'm going to do this. And when I see people want to do it but don't do it, this is some of the reasons why I see that they just don't know how, right? Maybe they have a little bit of education on exercise, and maybe they haven't exercised for a few years, or the last time they exercised, their body has changed a lot since then. Well, then you need to reach out to somebody to help you out, right? Just because you don't know how doesn't make you exempt. Another caveat there is I see people don't work on balance until it's too late. Like they don't actually start working on balance until they fall, right? That's too late. That's absolutely too late. You can start with a general exercise program. YouTube's a great way to look at it. I've got a lot of good YouTube videos out there. My YouTube channel is called The Resilient Spine, and I work on building exercises and different ways to strengthen your body and spine that's going to help reduce your discomfort, but also improve the way that you feel. Those are great places to start, but may not be the entire picture for you, right? Remember, you got to hit all those minutes. And so maybe it only hits a couple minutes. Maybe it's not enough. Maybe it's too much. You just don't know. And so sometimes teaming up with a professional can help you with that. And they're just not, another reason is people are just not willing to buy into that preventative care, right? They're just like, I'll just deal with things when they happen. Healthcare is not really healthcare, it's sick care, right? So let's just work on everything retroactively instead of proactively. Another a little bit of a kickback that I get is safety, right? Some people think it's not safe because they have XYZ going on and exercise isn't good for them. Well, unfortunately, that's just not true. So that's just what it is. Now, bonus, there's a dose-dependent relationship here. It means that if you do anything, something is better than nothing. You're going to have improvement, right? Some way, shape, or form, you're going to have a little bit of improvement. Now, it may plateau, but you're going to have some level of improvement. Bonus number 2 would be increasing the load. Now, if you're looking for people who are really successful, now I'm talking successful, like feeling super well in 70s and 80s, living on their own, doing their thing, living their life, they have some sort of load in there. So resistance work with bands or dumbbells, etc. It is safe. It is absolutely safe, but you have to learn how to do it. Changes in speed is a bonus too, because if you think about getting out of a chair, if you're doing it really slow, that's a change in speed, right? It requires a lot of power to get out of a chair. So you could generate the strength slowly, but can you do it quickly? Because when we start to lose our balance, do we lose our balance slowly or quickly? And so we need to incorporate speed still. And so that includes the power training. And then the bonus at the end is doing some actual heart rate monitoring, which we can dial in your body a little bit better with that. Those are all bonuses, absolutely all bonuses. But I'm relying on you guys to kind of lead the way with this, right? I can only treat one person at a time, and you have other physical therapists and providers that think like I do. We can only do one person at a time. But you've got to lead the way. You've got to take control of your health, because when you go into your primary care doctor knowing that, hey, like I've learned about these benefits of exercise, I know I need to hit these certain intensity minutes, like who's going to help me with that? They may help you, right? They may direct you to that person that they rely on to help their clients with as well. But when I look at people and I treat their body or their impairment that's going on, I also look at their entire body as well. And so you've got to have somebody that's going to have you taken care of. And so I often think of the model that dentistry has, right? They take care of your teeth every 6 months, go in there, check, make sure, x-ray, zap, she'll look at things. Oh, good, Mrs. Jones, everything looks good. Keep up with your good habits. Or they go in like, hey, this actually needs addressed. Well, you do that every 6 months. Like, I don't know why you don't treat your body the same way you treat your teeth, right? Your musculoskeletal system, your bones, your muscles, your flexibility. Go get that stuff checked up on, because you may need to dial in something that you are just haven't noticed yet, but there's been a little bit of change. And so develop that relationship to make sure that someone has an eye on your body for you. So lead the way, guys. You guys can do this. So I sped through that. That was a lot. This is a great presentation. So we've learned that, no matter your age, you can feel better, you can develop more, where you can build that resiliency and what actually needs to be done to move the needle to make you more resilient, less frail, and less vulnerable. That is a good place to be. It's an amazing place to be, but it does take work. And so in conclusion, you guys got this. You guys can get there. Everybody can get there, but it does take a little bit of work, a little bit of your time and resources. You've got to put in the work. If you want the outcome that you're looking for, you have to put in the work. And unfortunately, when it comes to your body and your muscles and everything like that, that's the way that it's done, right? They improve due to how much work you put in. Now, if you guys reach out to me, Michael@revisionhealthservices.com, Michael, I'll send you guys a free program that I put together that looks at the balance and strength and cardio, and like an example program of putting it together and what that would look like. Generic stuff that's not specific to everybody and not specific to anybody that's having pain, but just like what that activity level needs to look at. If you guys reach out to me, I'll give you guys that stuff. That's no big deal. Like I put it together for this talk and I offered it to that group. So it's a really good program and just a good place to be. And so I'm going to give you guys some ways to reach out to me too. So Facebook, Instagram, on my YouTube channel, The Resilient Spine. I also have a blog that I put out stuff like this. And there's my business contact number as well. And so if you guys ever have any questions, comments, concerns, you guys can reach out. Please just, engage in this presentation a little bit. Hope you guys spent the time here to just hang out and learn more from it. I'm very passionate about this stuff, and I'm not going to stop talking about it because this needs to be out there. And I really hope that if any providers are listening to this, you've got to start having those conversations with your patients. And if you don't have the time to do it, you've got to get them in the right direction to see the person that they should be seeing for that. And so I think I really do care about improving people's pain in that moment, and I want to improve your back pain so you can feel better and do more in your day. But we've got to have the conversation here that if you want really what you're looking for, health is a habit and you've got to earn it. So let me show you how to do it. And so you've got this. It's not too late for anybody to make change in their life, to make significant change as well. And resiliency is earned, and you have to build your team around you. And unfortunately, the healthcare system doesn't necessarily support that right now. It's not designed for that. And so stop relying on it for that. Take advantage of this time if you're feeling well, to better yourself and build that resiliency. If you're not feeling well, team yourself up with somebody that can get you feeling better and move you towards those markers that I was talking about, because it is important. So guys, reach out. I'd love to engage in some conversation, but as always, stay healthy, keep moving, and take care of yourself.